Breaking news. A few days ago in US, we all know that US is where everything you have freedom to everything except freedom to break the law, but you have freedom of speech, freedom of sexuality, freedom to do abortion. I think abortion was legalized during Trump's regime, and now it has been annulled. You cannot have abortion in the US, and I think that is why Lagos State is now taking step to launch guidelines concerning a lawful abortions in Lagos State. Before I go over details of today's news, if you haven't subscribed to this channel, please go ahead and subscribe. Hit the like button. Most importantly, click on the notification bell so that you can get notified whenever we post a new video. Without further ado, let's dive straight into the details of today's news. The Lagos State government has developed and launched guidelines for the development of safe and lawful abortion services within the ambit of the state's criminal law. The Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Gboye, presented a 40-page policy document tagged Lagos State Guidelines on Safe Termination of Pregnancy for Legal Indications at a stakeholders' engagement on Tuesday. Dr. Gboye said the need was born out of a desire for evidence-based data and information for health workers in public and private sectors. Gboye explained that while therapeutic termination of pregnancy is permissible under the law in Lagos State, the post-procedure absence of clear guidelines has stalled the effective implementation at appropriate levels of care resulting in preventable deaths. His words: in 2011, the Lagos State House of Assembly updated the criminal code providing for abortion to save the life and protect the physical health of women. While physical health is covered under the Lagos legal framework, services conforming to the law have not been available in the procedure of the state health sector. This document provides information on relevant laws applicable in Lagos State while providing standards and best practices with regards to legal indications, pre- and post-procedure care methods, the method and monitoring. I must state here that this document has undergone wide consultation with relevant technical stakeholders within the legal and health service context in the state. Gboye said the follow-up development of the guidelines commenced in 2018 with a Safe Engage project led by the Lagos Ministry of Health and hosted by the Society for Obstetricians and Gynecologists of Nigeria, with support from the Population Reference Bureau. He noted that stakeholders in the state health sector worked with key opinion leaders in Lagos and the Southwest region to develop a tailored advocacy tool for terminations within the legal context. He also pointed out that the advocacy messages on the Safe Engage project focused on ensuring that safe abortion services were available within legal indications in Lagos, and domesticating the Violence Against Persons Prohibition Act supporting women to terminate a pregnancy caused by rape or incest VAPP. To provide the implementation, one of the following outcomes recommendations of a project was the adaptation of the national standards and guidelines for safe termination of pregnancy within legal indications within the Lagos State context. The Federal Ministry of Health had developed and disseminated the National Guidelines on Safe Termination of Pregnancy, which highlights the compendium of conditions and circumstances under which termination of pregnancy could be instituted. The guidelines was intended to build the capacity of health professionals to identify pregnancies for which legal termination could be instituted. Mary Stopes International in Nigeria, in collaboration with the Population Reference Bureau, proposed to support the state government to adapt the document. Further, Boye says that the process of national guidelines adaptation included technical meetings to discuss sections of the law supporting safe abortion and conditions permitted within the legal framework, to save the lives and the physical health of mothers, and validation meetings with the broader stakeholders to review the document. All that hard work has culminated in today's dissemination of the guidelines. We hope this dissemination today will help guide health providers to provide this service within the ambit of the law, it stated. The country director, Mary Stopes International Organization Nigeria, Mr. Emmanuel Aja, stated that the development and dissemination of the policy of the policy document have once again proven that Lagos is leading the way for state-level intervention to stem the tide of unsafe abortion and give women and girls improved health outcomes. Noting that abortion in Nigeria is not illegal but restrictive, Aja said significant numbers of health providers are unaware of the legal indications for safe termination of pregnancy. I even thought that abortion is allowed in Lagos, not knowing that it is restricted, meaning that abortion in Lagos is only for people, abortions that can be done to benefit the woman in terms of rape or incest, or in a situation where it has been tested and it has been seen that the child that the woman is carrying is a disabled, or the woman can opt for abortion not to bear that child. You get what I'm saying? Leave your comments in the comment section. I would love to hear from you. Also, give this video a thumbs up. Most importantly, click on the notification bell so that you can get notified whenever we post a new video. I'll see you in my next video. Bye for now.